Assalamu alaikum. You're watching Views and News, and I'm Faisal Rahman live from our Islamabad studios. Today we'll be talking about this very important issue, and that is about the rise, or maybe you can call it the second wave of COVID-19, this coronavirus. Now, if you look at the figures, just talking about Pakistan, more than 3,000 people were diagnosed, and look at the number of tests which were conducted. There were around 30,000. So it's around 10%. And having said that, when you look at the total population of Pakistan, people living in the rural areas versus the urban areas, God knows what exactly is the correct figure out there. But one thing is for sure, that now the government is taking very serious steps. For example, schools will be shut down from tomorrow, 26th of November, in certain cases till January, in certain till December, and then another decision would be taken on the basis of the overall situation, and they'll review what exactly is happening. Secondly, when you talk about the current situation in hospital, it's getting really bad. Talking about Islamabad, according to certain sources, there's an acute shortage now of ventilators. And obviously, when you talk about that technical machine which is called vent, primarily you need to have a proper operator for that. And if you're talking about an operator, how to maintain the oxygen level, how to have the CPAP for that matter working, and how to have that proper, in case, God forbid, if somebody is on the ventilator, the chances of recovery becomes very less. And we all know that wherever inside the body, if there is some weak organ, whether it's the kidney or the heart or maybe the lungs, this particular virus, which is called COVID-19, can affect that. Though the trials are on, Pfizer says that they're very close to launching this vaccine for this virus. Almost 95% people have been recovered, maybe, because I do not know the exact terms which we'll be talking in our programs. They have been recovered either, or they have shown some positive symptoms after the use of that particular viral vaccine. But still, there is a long way to go. How many people live in the world? Around 7.5 billion. How many vaccines would be produced? How early these vaccines would be distributed in the countries which are the third world countries primarily? How to maintain that temperature? In certain cases, it is believed it has to be minus 80 degrees, in certain minus 20. So what exactly is happening is very alarming. A little while ago, I met this doctor when one of my colleagues was interviewing him. The gentleman was from Germany, and he was a German scientist who has worked over more than 750 different viruses. I just quickly asked him about the current situation. He says that, well, this lifestyle, wearing a mask, cleaning your hands, taking a shower the moment you get back home, keep cleaning your fingers, keep washing your hands, do not touch your nose or your eyes or your mouth for that matter. This SOP is going to be there for at least next 5 to 7 years. So you can well imagine till the last man with this virus is either cured or is dead. Simple as that. But what exactly is happening that nobody is looking after this affair seriously? Government can do to a certain level. It's you and me primarily who are supposed to look after each other. And that's how we'll be able to manage this menace. Otherwise, if you are thinking that since I'm wearing and you're not wearing the mask, or mask doesn't make any difference, or somebody was asymptomatic, he was just fine. Come on. A kid could be an asymptomatic, a carrier, but at the same time, maybe the grandparents would end up dying because they can get that virus from that kid in the house. That's why the schools are shut down. Doesn't mean that schools are shut down and you start taking your kids out for vacations and for party purposes and for shopping and going in the malls. For God's sake, these are the crisis times. Just think there is a war going on and we can't go out and there's an absolute blackout for the next month or so. We have to work on war footing. Try to understand what's going on. Just don't leave it to the doctors. Do you know the number of people who got infected in PIMS? I'm talking about the doctors, the paramedical staff, and the nurses, or the drivers who are carrying the patients from point A to point B. Now, this is what is happening. We will be talking about it. Let me introduce you to our panelists. We have with us in our studio Dr. Mohsen Ali, is an expert on infectious diseases. Thank you very much, Dr. Saab, for your time and for your presence here. Obviously, today the topic is so important. Pleasure is all ours, sir. And we'll be talking to Dr. Noman Zafar Saab, who's an expert, again, on infectious diseases. He's joining us on Skype. Dr. Saab, thank you so much since you have joined us, and you are present in the United States of America currently as we speak. And Irfan Ghori Saab, he's a senior journalist, a writer, and a columnist, and has been writing about this particular virus, COVID-19, in detail for quite some time now. Thank you very much, Gauri Saab, for your presence as well. But may I put the first question to Dr. Mohsin Ali. Dr. Saab,
yes,
I don't want to get into this data and all. I mean, the moment I switch on CNN, I mean, there is this whole box there telling how many people got infected today and how many died, and those numbers are alarming. And then the response to people, I mean, everybody is getting frustrated. Nobody is ready. For God's sake, we thought maybe it is a matter of a month or two at max. Now we're hearing this menace is going to stay with us. If we will not comply, it is going to stay forever. If we do, still it might take years and years and years. So the effect is going to be not only on the economy, on our mental health also, and the kids, and you name it. I mean, every person in the house is getting affected for some reason. Sir.
right. So, very important point that you have raised right now, that as a nation or probably as a species, we have not lived up to the responsibilities that we should have. As this pandemic hit the world, we were already waiting for it to go over and go to shopping and go outside and leave all the SOPs. And yeah, as the death toll started to go down, everybody on this planet was so happy to go out and go against the SOPs once again. I think this was the time when we gave it another opportunity to hit us back. Now, if you take
And that's not only about Pakistan, Dr. Saab, that's
all
exactly,
over the
it's all over
world.
the world, yeah.
Yeah. So as a human, all this society, it was frustrated, yes, but I think we have to prioritize the long-term goals that we have. Okay, we need to give our children the future that is livable, the air that is breathable. Okay, how can we do that? We have to put a break on our frustration, and we need to manage our stress accordingly. That's the psychological part and the behavioral part. The other part is technicalities. So what are the SOPs? They're not that costly, they're very cheap, they're very doable, performable. So wearing a mask, washing your hands, it doesn't cost much.
Social distancing or physical distancing, as they call
it doesn't cost much. So I think the rebelliousness of the whole human society has brought us to this again, the second wave. So now we see the virus more mutated, stronger than ever, and attacking in various ways. Before this second wave, when it first struck the humanity, it was just messing with the respiratory system. The saturations were going down and people were dying of the comorbids, right? The diabetics, the cancer patients, the kidney failure patients.
Heart patients.
Heart patients. Now it's causing strokes. It's causing so many various outcomes in different organ systems.
Is it because of the clogging, and then you keep on pushing the oxygen through the ventilator and the arteries, they burst?
It's because of the high oxygen rate and the superoxide damage. These are some technical words, but let me just tell you that when there is so much inflammation going on in your bloodstream, and then you're on the vent, and so many high molecules of oxygens are going around, it's going to cause some oxidative damage.
Doc, when we say that, for example, to control the inflammation in the body, there are certain very basic herbals which can be used.
Right.
For example, the use of turmeric, right?
Right.
Is it good that, I mean, on the level of the precaution, instead of, I mean, we should follow these SOPs, but still, there should be something additional added. Like, for example, they say that whether you have it or you don't have it, have loads of vitamin C, have loads of vitamin D3,
right,
have zinc for that matter,
right,
and so on and so forth. There's a long list along with the other SOPs.
So
do you think these are the precautionary measures also?
Yeah.
Or a part of the precautions?
So we have two facets of this same problem. Okay, the first facet is before this infection hits the body. So yeah, we have to take precautions externally, the physical ones, social distancing, mask, hand washing. Also, we have to keep our immunity at its best or maybe optimum. Okay, so for that, yeah, you can take multivitamins, you can take the best hydration techniques, you keep hydrated, you eat good, you sleep well, you don't fatigue yourself, you control your comorbids. Like if you're a diabetic, you need to control your diabetes, You have to control your blood sugar levels. If you are a hypertensive patient, you need to control your blood pressure. If you have kidney disease, you need to get your dialysis in time. But there is the other part when the disease strikes the body. Now it's an unpredictable game, you know. You do not know as to what is it going to cause to the body. Firstly, it
Even
was just
those people who eventually recovered from it, I mean, a lot of people have issues regarding their memory, and then a couple of
Yes.
people have issues regarding their body strength
Yes,
and
sir.
the aches, and they believe that it's going to take 6 to 8 months minimum to recover, or
and
maybe
not
more.
just that, the mental trauma that they have to go through. I mean, they go to post-traumatic stress because they have seen the death so closely that they take ages to recover from that mental agony.
It's just like
that
an
they put
accident
in.
you go through.
Yes, and you are being labeled as a corona affectee. Now you have to distance, and yes, you are now banned from seeing anybody.
And you know, unfortunately, a lot of people also believe that even if they have it, they won't tell it.
Yes.
They won't tell you about it, and they believe that, you know, there's a taboo associated with corona, as if it's something like HIV positive or something.
Yes,
that is another problem.
Yeah, there's a whole stigma, but how do we handle it? We need to communicate with the person, not just physically, so that physical domain is out. So we still have text messages, we have Skype, we have
Yeah.
so many things, but we tend to abandon those people somehow.
All right.
That's something that's going on. I've been seeing this. Other than that, I think that this whole perception that once you get corona infection,
don't
now
get it
you're
again.
done. Okay, so this is what brought people out of their houses, especially in Pakistan when Eid was closed, the lockdown was over, and people were rushing to the
And now
markets.
these public gatherings of various political
these
parties.
public gatherings and these marriage ceremonies and all that. I mean, it's raining today and everybody's out enjoying, eating.
You know, when the government has said that, okay, we'll shut down the schools, doesn't mean that you take your kids out for vacations and you start
Vacations,
taking
yeah.
them to the malls because they were, you know, they were so frustrated sitting at home maybe. This is how what we
Absolutely.
have to live with. Dr. Saab, if you allow me, sir, we'll go to Dr. Noman Zafar
Yes,
Saab.
please. Yes, please.
Dr. Noman, first of all, I would like you to comment on the previous debate which we were having, and also tell me now how to differentiate. The other day, a couple of people had regular fever or flu. We got them tested in our office, and alhamdulillah, they came out negative. The point is that, but everybody was scared, nobody was entering that room, and you know, there was this kind of a fear in our mind. We were, I mean, just looking at them, we were not talking to them. We are going, I think everyone in any organization must have been going through all these. Primarily, sir, how to differentiate that? A, is the test only solution for it? And you know, your comment on the previous debate. Please go ahead, sir.
Thank you very much for having me here. It's very hard to differentiate between like a corona, COVID-19 versus regular corona or adenovirus. So you have bacterial illnesses, you have a strep, and then you have viral illnesses. So honestly speaking, until unless we do a PCR or we do antigen test has sensitivity which is lower than PCR. The PCR has a higher sensitivity. But again, the problem is the collection, sample collection, because the error happens when you do the swab from the nose. The doctor is already exposed, so they are like scared of even doing the swab properly. So you can get a very easily false negative PCR. And if somebody is coughing, the first thing, yes, very right. Everybody it's like think about corona. Not everything is COVID-19. It can
Even if
be a
somebody
basic
sneezes,
corona,
Dr. Saab,
like first four types.
because of the allergy.
Oh, it can be, yes. It can be just simple allergy. It can be actually, I get sometimes reflux, and with the reflux, you can get a little cough, and the first thing you think, oh my God, I get corona. So, but the point is, there are a lot of people who are asymptomatic, and there are people who have mild corona, and they are the one who are transferring it. So the best way to right now to know, I think, is the testing, because if you are able to test, we have a machine available now in United States. We give you result in like 20 minutes. It's not a PCR. This actually is a nucleic acid amplification test. So basically, it's still the nose swab or a throat swab. You put in a cartridge, and it gives you like in 20 minutes the result. That's probably the best way. At least you don't get 100% sensitivity, but you get about I say about 70 to 80% sensitivity, which means that if you do like 100 people, about 70 to 80 who are really positive, they'll come back positive. So, but still there are like 20-25% people who are positive, they will be negative because of the error, or actually you say in the collection, the sampling error. So that's one thing. So it's, honestly speaking, it is very, very, very hard or close to like impossible to really tell just looking at a patient that is it corona or simple infection. Yes, couple of things happening in corona which is not happening in other viruses, especially loss of smell, loss of taste,
Yeah.
and fever. If they are three things together, I would probably say with a lot of certainty, without even doing an infection like testing, that this is COVID-19. Because regular corona, type 1, type 2, type 3, type 4, they do not cause loss of smell. Strep throat doesn't cause loss of smell and taste. So these are the, but if somebody doesn't have it, if somebody just have a fever, just have some cough, body aches, there is no, honestly, there is no way, no real way to tell
The only way
that
is
this
either
is
a
COVID.
PCR test or the other test which can actually tell you what exactly is the current status of the body. Dr. Saab, another point is that now we are also hearing that young people in their 20s and 30s are also getting infected. Earlier, we thought that maybe it is affecting the older people who are over 60 or 65 for that matter. And even the death ratio also, in fact, indicated towards that. Now, when we say that the virus is mutated, what about this mutation? It is keep on going to mutate, sir, and change the shape and its properties. I mean, because I'm a layman, I'm not a doctor. So tell us about that also, sir.
So first of all, I hope and I pray from Allah that it doesn't mutate. So from day one, so not day one, so after like a month or so since February, it has two strains. One was like there's two strains. One strain was from the Wuhan, and the other strain, yes, it got little mutated, like not a whole lot of mutation, but a little change of little strain. That was Italian strain. So that's why when you see the infection in New York, too much death in Italy and too much death in New York, that's because of that Italian strain, which is a little bit of a mutation. And the other strain, which was the Wuhan strain, which probably my guess is the Pakistan has it, and that was the light one, and that's what like if you see the Western United States, Seattle, Los Angeles, they have, or California, they have an infection which is milder than New York. So New York, because a lot of Italians live in New York, a lot. So everybody was coming from Spain, coming from Italy, coming from England. This was a more dangerous strain, and the light strain was from the Wuhan. So when we were talking about the like the infection, the amount of severity it causes. So we were talking the stroke. They were happening in United States in the New York area because this was a different strain. And I, from day one, I felt that Pakistan, with the grace of God, got the strain which is the milder one, not the severe one. So I called them a wild one and a mild one. So the milder strain, Pakistan still has it. But I'm worried that Pakistan is actually getting that wilder strain also, because the wilder strain causes your strokes, wilder strain causes your like ARDS, ventilators, like people die with this wilder strain because it causes so much inflammation in the body that basically you are drowning in your own fluids. Basically, too much inflammation, lot of all the extra fluid from your blood actually pulls up in your lungs. That's
Yeah.
called as ARDS. So that liquid actually is coming from your own inflammation. So the very interesting thing I want to tell you. So I have a friend, he's a rheumatologist, and their patients are all sick. They're all like rheumatoid arthritis, and they have chronic SLE, lupus patients, and they are, most of them are steroids, and most of them are on methotrexate, like chronic illness, and very strong immune suppressing medications. Very surprisingly, all of his patients, none of have died. Why? Because their immune system was already too weak to give a very robust response. So that's a very strange illness. Honestly, I don't think any doctor, any scientist in the world have seen an illness like this. That if you
I
have a
think it's a
very
new
robust
phenomenon, Dr.
immune
Saab, and
system,
this is going to stay unless and until we really, take proper
yes.
precautionary measures and follow the basic protocols. Now, Ghari Saab, let's talk about Pakistan. The figures are pretty alarming. I mean, the way it's increasing from hundreds into thousands, and now there are 3,000 plus people who were infected in the last 24 hours. Almost 5960 died. I mean, these are the reported figures. God knows what's happening in the rest of Pakistan, and people might think that, you know, somebody is dying because of regular fever, or for that matter, because of something else, or maybe a heart attack, and so on and so forth. But these are the reported ones, 10% around, you know. So your take, sir, you've been writing about it, you've been gathering so much data. Ghori Saab, how alarming is this? As bad as what we have witnessed in June or May this year, or maybe much worse than that?
Yeah, Faisal, thank you very much. And we are lucky that we have two doctors on the panel who can talk more about the technical aspects. But in fact, yeah, that's right. That during the last few weeks, we have seen the second wave, what we call the second wave of COVID-19. And if there was a myth, I would call, if the many people here, they believe that some miracle immunity or something was there in Pakistan, so that myth should be, it should be busted now with the number of cases we have been seeing. And as Dr. Noman Zafar was discussing, that he tagged one was the milder version and the other is the wilder version. So we pray that we stay in the milder version of the virus, because already our healthcare system, it is not capable that it would be able to, the population size we have and the density of the population we have, that if this these were the warnings you would you would remember then when it was the first wave, that the same warnings, and now, since because of the weather, I mean the cold weather, there are more chances that the situation can be more graver. And in this situation, in your intro, like you have discussed, that it is, the main thing is that we have to make the people realize that this is not some other creature that is carrying this virus. It's the human beings themselves. So with the simple, precautionary measures, you can save your life and your family and, rest of the humanity. So this is something which needs to be understood. And I'm sorry to say that in our, in our case, you go in a restaurant today, it was a violation, but I'm just coming from in Islamabad, in downtown Islamabad, in an area where there are many restaurants, and all those restaurants, there is no, they are filled to their capacity. So this is the situation when we are
It's not the
saying
problem
that
of the person running the restaurant. It's the problem of the people. Why do they go there? I mean, can't they have a cup of tea at home? They really have to enjoy that, cup of tea in the rainy weather, sitting in that restaurant. I mean, I fail to understand why. Because any person who is doing a business would love to have as many possible clients as possible. You can't blame them. You should blame people that why are you out? I mean, what was the need?
Risk benefit.
I mean, exactly.
Yes,
I mean, is
sir.
it worth it or
Is
not? We have to understand. Ghori Sahab, don't you think so?
yes, Faisal, it's at the one end it is the public, and I think it's at the same time it's the government has to come up now with some stringent measures, because just telling the people to wear masks, to adopt distancing, that is not working at all. So in that situation you would have to come up, it's if it was, but we were hearing that they would be allowing only the outside, dining or something, but in rain, everybody is sitting,
Sitting inside, yes.
in those restaurants. So same is the situation of our religious gatherings. Same is the situation of our political gatherings. So we are inviting actually the worst scenario by our own actions.
I totally agree with you. 110%, sir. I've seen the kids in schools. Honestly, they were, those who were having the mask, they were having it right on the chin. And they were
No, but
playing
the
and they
kids
were.
were exchanging, some kids, they
I mean, if
told
there is a
us
ball
that,
you're playing
the
with,
kids,
and then you're
they
sneezing
exchange
and
the
you're throwing
mask
the
with
same
each
ball to
other.
another, maybe it's rolling on the road or something, somebody has spent. I mean, there's so many angles you can associate with it. But now, coming back to you,
Yes,
Dr.
sir.
Mohsen, now, a couple of, SOPs which were there in place, and we were
Right.
told, and everybody, in fact, because when the first wave came, nobody knew what it was.
Right.
And we were just getting to know about it through the Western media.
Yes.
And the Western media is always very influential. Unfortunately, we believe, oh, wow, so many people died. God forbid. Thank God, in Pakistan, it's better. Then we started having different perceptions that maybe our immunity level is too high, which is not true.
Yeah,
it
it
can't
is
be
not true.
under these circumstances, this kind of
Just because
nutrition
you got
and this
lucky.
kind of an environment. Yeah, exactly. My point is, sir, that when you talk about the SOPs, they can save you to a certain level.
Yes.
If you are taking, please inform our viewers, inform our audience, inform whosoever is listening to us, that no matter what you do, but if I'm not taking the precautions or following the protocols, I am the spreader. Then I should be either hanged, because this is as bad as 307,
Yes. So, first of all, the main reason that I came to this show is to inform all of you guys listening to me right now that the thing that brother discussed right now, that Islamabad downtown, okay, we always blame ignorance, right? This Islamabad downtown, all of them are educated, well aware, they can read, they have
having
all-
parties, having GTs, having
parties,
weddings,
having weddings,
birthday
These-
parties, you name it.
This is not some rural, unsupported, uneducated population. This is the elite of your country, and you guys are sitting in different restaurants just because you have to maintain certain standards. The risk-benefit of ratio of this activity is not that good. And I request you all guys, we, the doctors, can only do so much in the hospitals. We try to tell you about the SOPs that you have to follow, but you have to follow them. And we try to maintain the damage that you guys did with your body once you present in the hospital, once you're on the ventilators. We try to minimize that, and we can only do so much. So you guys have the remote control right in your hand by following the SOPs, by prioritizing your life and your kids' life over these activities, over these gatherings that you crave so much for. I urge you to take care of your families, to take care of your kids, save them from this second wave, because the doctors cannot prevent everything. It is you guys, you the people, have to understand that these SOPs mean something, that washing your hands, that social distancing, that wearing a mask is not something that Imran Khan will come to your home and tell you that please wear a mask, or the inspector sergeant he's going to look at you, mask, and that's it. But you have to wear it properly, you have to seal it with your nose, you have to wash your hands religiously. Please take care of your health, and I mean it, please. It matters, your lives, all of them, they matter, and especially the kids and the elderly and the diseased
Everyone
ones.
in your family.
Everyone.
Doctor, the condition, let's talk about one more very important factor, the capacity. We do not have that kind of a capacity.
Yeah.
Number of people versus number of doctors available, and doctors who specialize in this, and then you have got big hospitals, and there's nothing in the rural areas. To be very honest, I mean, this is the reality, unfortunately, but
Right.
this is the way. I've also learned, let me ask you this question, that there was this Dr. Saab, Young Doctors Association's president, and he was put this question by, I'm not sure which anchor was that, and he said more than 200 paramedical staff, including number of doctors and the nurses, are corona positive in PIMS only.
In PIMS only, yes, that is true.
Just imagine now, this is what we are saying. PIMS hospital, just one hospital in Islamabad. Just imagine what is going on.
And
the conditions and the capacity, I mean, how there will be
See,
no ventilators available for the patients at a burden. Like this is what we have witnessed in Italy. If you remember those initial
Yes,
visuals, the
Italy
people
and
were lying
Spain.
in the corridors and they were dying there.
they were dying there, and there was nothing
And this
that
situation,
they could
Allah
do.
maaf kare, Toba Istighfar, can be witnessed in
It's
Pakistan.
on its way, sir, it's on its way. If you and I are not going to take care of the precautions, and if we are not serious about it, and we just laugh it off over a cup of coffee in some posh area and at some coffee shop or some restaurant, it's on its way.
And you know, people are acting, oh my God, we are so, we are stuck at home and we are so getting frustrated. Oh my God, I really want to meet my friends. For God's sake, sir, I haven't seen my friends in for the last 8-9 months. I
Yeah.
come here, I swear, and I go back home and I can see my kids, I can't come and hug them.
Yes.
I just can't go and, this is the kind, because my wife is working with the COVID
Right.
and she's also, she's taking a lot of precautions. I mean, she's at a different optimum level, but what I'm saying is, it gets frustrating. But this is the way
It
it
is
is.
what it is.
Yes.
It is what it is frustrating.
And,
Yes,
and
I
a lot
get
of
it.
people initially,
You
you know,
want to
even in
hug
our
your
office,
kids.
Dr. Saab, let me put this question to my dear friend in Noman Saab in USA. That Dr. Saab, a lot of people thought it's a myth. It is nothing, basically, just, you know, doctors are trying. Even my own brother, who's based in UK, his wife is a doctor, and he says, well, you know, this is the drama of the doctors. And I had an argument with him. He's an educated guy. He said, no, you know, you have no idea what the pharmaceutical industry can do and how these, you know, then he started talking about the, yeah, anyway. But this is what it is. Dr. Saab, your take.
Okay, very interestingly, I have the same kind of situation. First of all, we talked about it in the United States, just like Pakistan. There's a whole split. There is a
Yes.
people who are
Even in
taking care
Europe,
of it,
Dr.
just
Saab,
like
people are
you and me.
protesting in Ireland and places like England also. That there's
So
nothing
everywhere there's a
such as
split.
COVID-19. It's just a drama.
So I'll tell you a very interesting thing. So my brother, again, when you're talking about your brother, my brother is a physician. He's an anesthesiologist. He's in Multan Nishtar Hospital. He's the one who put people on ventilator. He's getting married next month. So he wanted to do a big wedding. I kept explaining, you cannot do that. And he is the one who's putting people on ventilator. And he thinks the corona is a hoax. And I'm literally holding my head. What are you talking? So if I cannot, like, I'm surprised. We're talking about the people who are living in villages, they don't understand corona. But the people who are educated, the people who are doctors, so there is a split.
And who are
I think
dealing with
one,
COVID-19.
Yes.
and the people, I'm like, I literally cannot understand. There's a person who's dealing with COVID patients. They're putting people on vent. How can you even think about? The whole problem is every human being. That's what I feel. That's what's happening. They think this disease is not for me. This is not for me, and that's why they are not taking precaution. They think we are like kind of immune to it. Psychologically, they're just thinking this is not for me. This is for somebody else. So I think that's what the problem is. We need to understand anybody can get it. Anybody. People going to the mosque here, they think we're going to the mosque. That's why we're not going to get it. Okay, this is an infectious virus. It's not going to like decide whether you're going to a mosque and you know we're not going to reach to
It's an
you. So
invisible
we
enemy,
in our
sir.
mosque
Simple
we
as
have
that.
people like, pardon.
I said it's an invisible enemy. I mean, you do not even know.
Yes.
It's totally camouflaged somewhere.
It cannot like decide, okay, because you're a doctor, so I'm not going to attack you. You are like a PhD person, I'm not going to attack you. And you are like a tractor driver, I'm not going to attack you. It doesn't differentiate. That's the point is we have to take care of. So last week, I need to tell viewers, important, my one of my worker in my village, and I kept was hearing from my village, oh, there is nothing in villages, nobody has corona. His daughter, 27-year-old, got corona and she died. 27-year-old, no other health issues, got corona, had ARDS, put on vent and died. So the
At the prime
question
of
is,
your
there is
physical
no
fitness,
guarantee.
27 means that you're young, you can take it. But
Yep.
still, yeah.
When I look at them and I said, I mean, now can you understand? Can you stop this wedding ceremony of 200, 300 people? I supposed to come. My flight was booked for 5th of December to Pakistan. I canceled the flight. I said, I'm not going to attend the wedding because this is stupidness. I mean, we not only putting ourselves in like danger, our parents,
All
our
those who are
uncles,
attending the
aunts,
function.
everybody is in danger. And we may survive, they may not. That's the problem. I think people need to understand that we are young. So the whole same thing going on in the United States. I'm young, I don't have trouble. So even I went to a dentist. He's a young dentist, and he's not even properly wearing a mask. A dentist is not properly wearing a mask. His nose is open, and I said, okay, well, you're not properly wearing a mask. Oh, I'm young. I don't worry about it. I said, okay, but if you have corona, you're going to infect
What about the
every
patient?
single patient. You're actually doing
Doctor, what
procedures.
I do is I'll just show you. I carry this bag. It has got plenty of stuff from soaps to sprays to you know, everything. Extra masks also, and I keep on giving and distributing it to most of the people
Wow.
in my office every day. Ask them,
Okay.
and honestly, you know the kind of response I get. Sir, मेरे पास तो है जेब में पड़ा हुआ है. You know, this is the answer.
Exact
is the attitude,
same
I'm
kind
telling
of
you, sir.
situation here. I think people, either doctors, either educated people, uneducated people, rich, poor, everybody need to understand one thing. This is a virus. It's a highly infectious virus. It doesn't differentiate. And again, the problem with this virus is it's a very strange disease, and like we already know about it, that nobody knows. If you get it, you may get a wild one, and you may get a mild one. But if you get a wild one, there is no coming back. There is no coming back. If you're gonna get strokes, and initially we were talking how people die, they get strokes. Either they die from a massive stroke, or when you start to give them anticoagulation, they actually die because of the bleed. And there are people, actually I've seen people who have amputations, like hand and feet amputations, because there was a massive artery was blocked
Dr. Saab, this
in
is
their leg,
exactly
for
what happened to
example,
one
so
of
they have to
my
amputate.
friend's mother. She passed away a few days ago because of corona. The entire family is in medicine, he himself and the father and everyone. And the interesting part was that the whole family got it. Unfortunately, the mother passed away, and then they thought that there was gangrene on the arm. It wasn't, because I don't know what it was, but I think this is exactly what you were saying, that everything gets clotted, and then, this is what happens. There was no flow of the blood towards that arm. All right?
There's another friend who called me from London, and he said he's supposed to go to his nephew's marriage in Karachi, and he kept fighting with them, don't do it. And that's the reason I'm sharing these stories, because people need to understand. So they did the marriage ceremony, 200 people, and now a lot of people got corona. Multiple people are on like oxygen right now, and like some people are in hospital just because of the one function. My question is, there is no comparison of going to hospital, getting on a ventilator versus an infection or like a dinner. Honestly, there is no real comparison. We cannot say, okay, there is no paratha, there is no roti, there is no garam roti, there is no kadai, there is no chicken is more worth than your life.
All right.
So I'm
All right, Dr.
surprised.
Saab,
I'm
because in
really
the, in the,
surprised,
the
Rajiv.
third round of this debate, we will talk about the remedies and the solutions. But let me put this question to our friend Gauri Saab. Gauri Saab, Dr. Faisal Sultan has said that COVID-19 vaccine will not be available till the end of the second quarter of the next year, means by the end of June. So you are looking at somewhat like 8 months, no vaccine in Pakistan.
Yeah.
Correct, sir? And even if
Yeah.
you have invented a proper vaccine, we do not know how we will be able to bring it to Pakistan, keep it under those technical,
Minus 70.
yeah, minus 70, minus, in certain cases they say minus 20, in certain cases they say minus 80. Whether Pfizer is making it or XYZ's company is making it, or maybe Oxford University has manufactured it along with somebody else. The point is the availability, the pricing. The government has just said that, oh, we'll allocate how much? $150 million dollars for a population which is 250 million most likely. Now the point is, this kind of an engagement, distributing it, because we haven't been able to eradicate polio, that's what I'm saying, which cannot be transferred like this disease. What is going to happen, sir? What needs to be done now?
Faisal, yes, that's true that all those, I mean, the ones that have been made, still we are not sure the technical, the doctors can tell you better, but still, I mean, what we have been reading about those vaccines is that it's not for sure that they would be 100%, cure or something. And at the same time, then the whole chain of those vaccines reaching to the common people, that would be another question mark. So at this moment, the only thing that you can do is to contain and prevent. That is something which we all have to focus. And like Dr. Noman was mentioning, that we have to sensitize the people, that it is, with those functions, with those gatherings, the impact that after those gatherings, the people have been, the families that have been getting. So that is important, because right now it is the callous attitude of mostly in our case. And then I would again emphasize, yes, that's true that the government cannot do everything, but in our case, we have just we are closing down the schools and colleges. But if the people are having gatherings outside the school, the same kids, if they are gathering in restaurants, they are gathering in other social places, so there is no use of closing those schools. Similarly, if the other congregations, they are going on, so that won't help at all. So when it comes to implementation, it should be across the board. When even today there was a meeting of parliamentary committee on COVID-19 in parliament. The opposition, they didn't attend it. It's unfortunate that that it's a national issue and you are not going. Similarly, if you see the GB elections, the campaign, be it the opposition parties, People's Party, PMLN, or PTI, everybody was
Bilawal
doing,
Bhutto's
trying to gather maximum number of
political
people.
secretary, Somro Saab, got it. Bilawal Saab himself is in quarantine.
Yes.
Mariam Nawaz Saiba, I hope she stays well. Her husband
Yes.
got sick. Raja Pervez
Yes.
Ashraf got
And
sick. Kaira Saab got sick. Murad Ali Shah. I mean, there's a
yes,
long list, sir. For God's sake, I mean, so many, over 100, I'm not sure about the exact number, is it 130 or 150 parliamentarians who got sick, who had corona, sir, at some stage. I mean, just look at that number and just compare it with the rest of the population. I don't know whether they earlier decided to go for the herd immunity. Now, what Sweden is doing is different, what UK is doing is different. Then they realize, we made a mess of it. And now what to do? I totally agree with you. It's us. It's totally about us, and we are supposed to look after our own affairs. Last 3 minutes left, sir. 1 minute for each gentleman, sir. What needs to be done? I learned that taking steam or having hot drinks and cleaning your nose and you doing gargles and then using the mouthwash for that matter, it helps.
It does, but there's other part to this as well, which we did not get to talk about much, and that is basically making the trial successful. Okay, so my team with National Institute of Health and National Command and Control Center are working on the vaccine. So the vaccine, we have participated so far 3,000 patients, and the healthy participants, I shouldn't call them patients. So these healthy participants, they've had a very good response to the vaccine, as only 50 of them just got self-limiting fever. If we were to give them a flu shot, it would have been 700 people with self-limited fever, 101, 102, just resolved by paracetamol. So we have to take the SOP seriously, but we also need to get this vaccination trial successful, make this successful. And how can we do that? We can urge people to participate, the healthy people, the young people, to participate in the trial, because the phase 1, phase 2 is done by now, and now we are in phase 3. That means that safety and efficacy is already determined. Now we need to look for the protective effect over the months. So our target basically for the whole country, as NIH has said, and it's from the government, and the government is helping us a lot. I just had a meeting with the National Disaster Management DRR Ibrahim Masood Saab. He was also endorsing our team, and also the NIH leadership is helping us a lot with this, that we have to achieve the target of 10,000. And once we do that, the vaccine is going to be available as soon as possible. Not just the SOPs are going to help us, but we have to create herd immunity.
Is it totally indigenous, or is it with the help of the Chinese or some sort of
It is a
collaboration?
merger of China and NIH.
Okay.
So NIH is working in parallel with China. So we have 3 centers: Aga Khan, Chaukat Khanum, and Shifa.
Also, the best in Pakistan.
Yeah, yes.
All right.
So then the Indus and UHS also took part in this, but SOPs can only do so much. We have to give a herd immunity. How can we give the herd immunity? Either the whole nation gets infected, that's the worst case, so we get to lose a lot of precious lives again, or we give them vaccine and they
You never
develop
know
an
if
immunity.
everybody has the herd immunity. You're done with that. You had it once, and now you want to move on. God knows it gets mutated again.
Yeah,
we heard about something different, COVID-20 this time, and hitting us. You never know, sir. Dr. I'll just go to Dr. Noman Zafar. Sir, your take. I mean, what needs to be done? Precautions again now in the current circumstances.
I mean, first of all, we are very close to the vaccine. Yes, actually in the United States in December, the Pfizer and Moderna vaccine is coming, and they are giving it to about like 40 million doses, and they're giving it to the older than 65 people first and the healthcare workers. So we probably may get it. I hope Pakistan get it soon. So I'm just going to tell people, just hold on, few more months. Mask. Wash your hand, social distancing. That's it. Because there is no other way around. We just are very close to the vaccine, and we pray to Allah that we don't get like a COVID-20 or any mutated strain of COVID-19, and then the vaccine will work, inshallah. And then once we have vaccine and we have antibodies, then hopefully the life will go back to normal. It will take some time for that fear to go away. But again, until then, we have to be careful. There is nothing in the world, nothing, no dinner, no,
And
no
Dr. Saab,
function,
as we
nothing
say,
is
this
more
thing,
important
sir,
in
this
our
thing
life.
on our face is going to be the new normal. This is going to be the new normal. And people have to understand. Gauri Saab, Dr. Saab explained
Until unless
everything,
we have
but he
antibodies,
missed out
yes.
on one factor, and that is about that people should also use their brain. You know, that is the most important part.
That's what we are urging. That's why we're urging for months and months and requesting and kind of begging people that please, this is not a joke. This is not a
Dr.
joke.
Saab,
The
I think
problem is,
some serious fines should be, given to those who are not following the SOPs the way they did in Europe, like 150 to 250 euros, if you remember, and they would understand then. Or just put them in jail for 3 days, sir, and they will get the herd immunity there, and then they'll understand how it works. Because I don't think we will be able to eradicate this menace in the current form and strategy and the mindset. Gauri Saab, closing marks.
Yes, Faisal, the good thing is that as the doctors have said that there is a light, we can see a light at the end of the tunnel, which is a good thing. But till then, we have to, first thing is that we have to come out of those conspiracy theories that this virus is a man created or however it is it real or not? And then the following of these precautions, or we call SOPs, and their strict enforcement. That is needed. That is need of the hour if we want to save the lives of. I don't know how many people. You can't imagine if God forbid God forbid if spreads and gets worse. So till then we have to strictly follow those SOPs.
And Dr. Saab, one thing is for sure, I think the role of media comes here. I think we should have a very, very super aggressive campaign on all the media channels. The Urdu channels, the English channels, Saraiki, Punjabi, Sindhi, Pashto, Balochi, all the channels. And there should be a massive campaign on radio as well as in the newspapers that this is what you need to do. For God's sake, it is a matter of 3 weeks. Just look after yourself, your family, and it is going to die its own death. That's the way how many countries have done it. But I think, look at New Zealand for that matter, sir. Aren't they human beings? They also have a different kind of a weather there. But I don't know
Singapore
when
today.
our nation is going to learn, sir. But anyway, totally running out of time. Dr. Saab, thank you so much for joining us from United States of America. Gauri Saab, it was a pleasure having you, sir. Then thank you so much for your input. It was a pleasure, Dr. Mohsin Ali, as well. And that's all we have for this hour. But what should I say? I mean, if you love your loved ones, if you love yourself, if you really love your country, let me put it this way, for God's sake, for your own sake, and for your family's sake, for your country's sake, follow the SOPs. For God's sake, don't, I mean, what should I say? I totally run out of words actually when I think, because what should I say? I mean, just for God's sake, be careful. This is not a joke. This is not a joke at all. I'll see you tomorrow, inshallah. Till then, you take good care. Khuda Hafiz.